What is visceral fat and why can it significantly shorten your life? How can I easily know, without any test, without needing to do any additional technique or test, whether I have visceral fat or not? And most importantly, what habits, what steps do I need to take to eliminate that visceral fat or at least reduce it considerably and thus reduce the risk of having certain pathologies? Here is Dr. Borja Bandera, a specialist in endocrinology and nutrition. And today we're going to talk about visceral fat and how to reduce it. So pay attention because this information is important. First, what is visceral fat itself? What if I told you that there are different types of fat in the body and some are much more dangerous than others? In this video, you'll easily understand what visceral fat is and how it differs from other types of fat. Fat serves us, as you know, as a method of storing excess energy, and an adequate amount of fat is vital. For what? To guarantee many basic bodily functions, we cannot survive without what is called essential fat. How many types of fat are there? Fat can be differentiated into two types based on location: subcutaneous fat and visceral fat. Also, according to other criteria, we can classify fat into yellow or white fat and brown fat, a special type, very specific type of fat that generates heat by burning calories, and I explained it in this other video. Subcutaneous fat is the main target of the fitness industry and the one everyone hates. Why? Well, because it's the most visible fat that accumulates under the skin, in the belly, in the arms, in the legs, in the hips. As I was saying, it's the one that bothers us the most. Because the current ideal beauty prototype involves having a low or very low percentage of fat in general. Something that has not always been the case throughout history. What if I told you that this subcutaneous fat is the least problematic and that even a certain accumulation of it can be protective for some pathologies? However, there is another type of fat that you already know is visceral, which is a real threat to health. Visceral fat accumulates, as its name suggests, inside and between the viscera, mainly within the abdominal cavity. Have you ever seen or noticed that some people have a very hard belly to the touch? Well, that hardness is not caused by anything other than visceral fat that protrudes in the abdomen above the abdominal organs. This buildup of visceral fat creates several issues that we will examine. Most organs can accommodate a certain amount of fat. But when a large amount of fat accumulates within an organ like the heart, kidneys, or liver, the functioning of this organ begins to deteriorate. We call this lipotoxicity or fat toxicity. Similarly, this visceral fat releases hormone substances called cytokines, which in a way are toxic to the surrounding organs, increasing inflammation in your body. For example, visceral fat in the liver or heart. It not only affects the liver or the heart, but it produces substances that end up passing into the blood and can affect the whole body. Moreover, visceral fat directly causes fat buildup in arteries, thus increasing the risk of cardiovascular disease. Having a heart attack, stroke, or peripheral arterial disease indicates visceral fat. Borja, how can one determine if they have visceral fat? What is the normal percentage of visceral fat? Well, it's not easy. It's not simple to determine how much visceral fat you have in your body. However, we can get a pretty good idea with some tricks that you're going to learn right now. The most precise method to measure visceral fat is through a magnetic resonance imaging or computed tomography scan. But these procedures are not accessible to everyone. They are costly. And also, in the case of the computed tomography scan, it exposes us to radiation that is totally unnecessary for this purpose. Approximately, in a healthy person, 10% of total body fat is visceral fat. If you have 10 kilos of body fat, around 1 kilo is visceral fat. But then, how can I know or get an idea if I have a lot or a little visceral fat? Well, the waist-hip ratio is a very simple tool to determine if you are at risk of having a lot of visceral fat. Take a tape measure and measure your waist at the level of your navel with your stomach relaxed to get your abdominal circumference. Then measure the circumference of your hips. Then, relate both parameters, a value above 0.95 in men and above 0.8 in women. It warns of a too large waist circumference and puts us at risk of having visceral fat and the undesirable effects of this type of fat. But what really causes the appearance of visceral fat? We could summarize the answer to this question in 4 words. Faulty lifestyle. A lifestyle not in accordance with our biology. It leads to an increase in both subcutaneous and visceral fat. Visceral fat accumulates in our viscera when we are exposed to a chronic excess of energy. Chronic excess of energy, and when our metabolism is not working well, it is damaged, it is deteriorated. The factors that contribute most to the deposit of visceral fat are a high consumption of simple sugars and refined carbohydrates. Do you already know? cookies, pastries, white bread, pastas, juices, shakes, sugary sodas. Also a high consumption of alcohol, insufficient or poor quality rest. Chronic stress not properly addressed, sedentary lifestyle, spending many hours sitting, excess blue light at night, and the consequent chronodisruption. Exposure to various endocrine disruptors and environmental pollutants. And we could go on because there are many more factors. And how can visceral fat be eliminated? We already know that visceral fat has a very negative impact on your health. Well, but the good news is that fortunately there are studies that tell us it's a type of fat that responds very well to lifestyle changes. Here's how to eliminate visceral fat quickly. First, remove unnecessary stressors. Excess cortisol hinders lipolysis and visceral fat oxidation, preventing the breakdown and burning of fat. When we talk about stress, work stress always comes to mind. But a poor diet, sedentary lifestyle, or lack of sleep are forms of stress with a negative impact on your body, so keep that in mind. Try a low-carb diet. Well-done low-carb diets have been shown to decrease visceral fat, can be reduced effectively and quickly when done correctly. In this 8-week study, users who followed a low-carb diet lost 10% more visceral fat than those who followed a low-fat diet. However, beware, this does not mean that it is the only diet that allows you to lose visceral fat. Far from it. Actually, any diet that makes you lose weight and maintain the lost weight can achieve this. And if your situation is extreme and you need super fast weight loss, you can go a little further and try for a few weeks. The ketogenic diet, which despite being high in fat, quickly reduces your visceral fat if you do it right. Here is the link to our Empower Academy course on the ketogenic diet, where you will learn everything from beginning to end about the ketogenic diet. Next point, training is non-negotiable. The most effective is probably aerobic exercise, performed at a moderate or high intensity. If you want to maximize results and cut the time you need to reach them, then you can add 3 or 4 strength training sessions a week, with the combination of aerobic training and strength training being the most beneficial. Boost your soluble fiber intake. I've previously discussed the advantages of soluble fiber. When soluble fiber reaches the colon, the last part of the digestive tube, the bacteria there ferment it, producing short-chain fatty acids, molecules that have a beneficial effect on visceral fat. In addition, soluble fiber will reduce your appetite, helping you lose weight. Where do we get soluble fiber? In legumes, in oats, in sweet potatoes, in psyllium husk, in guar gum, in santana gum, in flax seeds, in chia seeds, or in many fruits and vegetables. Simply increase your protein intake. More protein means less hunger due to the modification of various hormones, also greater maintenance of muscle, of lean mass. And all of this as a whole will help you lose visceral fat. Don't be afraid. Increase the consumption of protein sources like bluefish, meat. Choose a trusted supplier for grass-fed meat, eggs, legumes, soy, and whey protein when possible. This recommendation is invalid only if you have a chronic condition, such as kidney disease, that contraindicates significantly increasing protein intake. Cut out alcohol. When metabolized in the liver, alcohol is similar to sugar. In addition to adding empty calories, it increases the risk of various health issues. Cut out sugar consumption to reduce visceral fat. Sugar is likely the most significant factor directly linked to visceral fat accumulation. It's something that can be directly verified and seen. In usual clinical practice, when with ultrasound we see how much visceral fat patients have and what diet they follow. A high sugar diet is often linked to increased visceral fat. For example, replacing the calories provided by sugar with the same calories, but coming from starches like rice and potatoes. Sources of carbohydrates. In this study, he reduced visceral fat in the liver by more than 10% in just 10 days. Impressive. That is, the liver quickly cleanses itself of visceral fat when we leave sugar. Enhance your rest, not necessarily by sleeping more. Steer clear of heavy meals right before bed. Try to put aside work and personal problems before going to bed. I know it's easier said than done. And try a magnesium supplement, melatonin, or even ashwagandha if you think they can help you. Intermittent fasting can help you lose visceral fat if done correctly. Specifically, in this study, participants lost between 4 and 7% of visceral fat over the course of the study. That's it for today's video, guys. Thanks for staying until the end. It helps me a lot. Subscribe to the channel, share the video if you found it useful. See you soon. A big hug and keep empowering.